I didn't decide that I wanted to be a physician until probably about high school and the beginning of college. But I did know that I wanted to take care of people from a very early age. So I come from a very large family, and I'm the middle child, so it's kind of just ingrained in me to take care of very large families. It wasn't until the very end of third year in medical school when I looked back at the entire year of rotations thinking, oh, I really like this and I really like that. And it wasn't until I did my family medicine rotation where I thought I could do a little bit of everything. You could have a day where you see a newborn, a teenager with a hurt knee because of a sports injury, following somebody for their diabetes or other chronic illness, or even having a end-of-life discussion with a family. And really at the end of those days, you kind of sit back thinking, geez, this was a very tiring day, but I really did family medicine, a little bit of everything. Over the course of time, I think we got caught up with trying to treat as many people as possible, and I think now we're realizing it's more the quality than the quantity of treating patients. So getting back to that bedside manner. I would say my philosophy is holistic. So medicine is both mind and body, and we have to keep that close to heart. So when you're treating the patient, it's just not, here's a medicine and I'll see you back in a few weeks to see if it worked. You really have to understand the patient and where they're coming from both the mind and body perspective. Well, there's a lot of information that's out on the internet and just our media in regards to holistic approaches and other types of medicine. So I think it's up to us to keep an open mind to try to treat the patient, because they may not want to take the medicine that you prescribed and they may want to take something else. So it's really looking at the pros and cons and the risks versus benefits in that situation. I'm very blessed to have a loving husband and 2 daughters, so it definitely gives me an idea of, from a parent perspective, when I'm talking to other parents, and if you've had a child who's having some difficulty sleeping through the night or they're not eating certain foods, I can identify with that. I love movies and I like to do crafts. I may not have as much time to do crafts like I used to, but I like scrapbooking and crocheting.